Nicola Hill joins us from London. Nicola, I don't know if you heard Professor Sian Griffiths. She was talking about very basic, straightforward public messaging is critical. The British government has been accused of being a little bit sort of confused about its messaging, that it's been a little bit mixed messaging. Is it, do you think, more a case of that, or is it a case that younger people simply aren't following the rules?
I think it's probably a combination of both, really, Adnan. And if you remember when they changed the first message that we had here in the UK about coronavirus, stay at home, save lives, when they switched it to be alert, there was a lot of mockery about what exactly does that mean. But I do think that there is definitely something that's being said, that's being agreed, that it is younger people are perhaps, they're bored, they've had enough, they feel that they've done this lockdown for long enough, and they're beginning to think, well, it's not really myself who's in danger here, or if I get the symptoms, they're going to be mild, if available at all, if possible at all. So they are perhaps being a little bit more lax. There is also, though, the figures that both you and Professor Griffiths were just saying there, 2,988 cases yesterday, a massive jump on what it has been. This, seven-day rolling figures. It was something like 1,800 cases a day for the past 7 days, 1,200 cases the week before that, and 1,000 the week before that. One of the theories might be the fact that there's an increased number of tests. But of course, there's a lot of consternation about the availability of testing here in the UK. The government sort of has moved where the best areas to go to get tested. They've moved them to the hotspots. That might make sense because you've got more people who are coming into contact with the virus. They need the tests. But what it does mean is that people who live in the areas where there's very low levels of infection can't then get hold of tests. We're hearing about people being told that they have to travel 70 miles to go and get a test. And I actually know somebody who wanted to get tested and was told that she needed to travel 90 miles. She doesn't drive, so that was going to be a number of trains and a bus to get to a testing centre. If she had been infectious, she'd have been possibly infecting other people. And she actually decided not to bother going. And this is definitely one of the issues that's being discussed quite a lot here. Are our numbers in the UK going up because of people testing? But are people actually being able to access those tests?
Absolutely incredible in a country that's supposed to be the 5th or 6th biggest economy in the world. What about the dangers of the reopening of schools? I mean, we saw in Germany, also in Israel, and I'm sure it's happened in other countries as well, that when schools reopened, community transmission increased quite significantly.
Well, this has been the biggest fear, hasn't it? And that's why a lot of people were very anti the reopening of schools. One school has already shut, but some children are still not going back till this week. So that's something that we're going to have to wait and see. It seems the figure quoted yesterday doesn't take into account since schools have reopened. And of course, the argument for the reopening was the mental health effect on children who had spent so much time in lockdown, 6 months, without sort of being able to be with their friends. But it is something that is certainly going to be looked into, as is the different areas and the disparity. I mean, I live here in London. I'm here from London. Now, in June, it was estimated that 17% of the local population here had come into contact with the coronavirus. And the infection rate here in the capital of the UK is actually low. And the thinking is that people here, because there were so many people infected, people are actually abiding by the rules perhaps a little more. They're able to work from home, they've been furloughed, they are washing their hands, wearing their face masks and everything, and they're avoiding public transport. But in some of these hotspots in the north of England, Manchester, or in Scotland, in Glasgow, it's a much more industrial area. People can't work from home. They're having to go back to factories. And that may be one of the reasons why there's much higher rates of infection there.
Nicola, thank you as always. Nicola Hill, our health correspondent in London.